We are back on MorningLine. Thanks for joining us, talking about possibly the holiday blues, or at least dealing with the holidays during the pandemic as best you can mentally. With us this morning is Dr. Lloyda Williamson. She's over at Meharry Medical College. She is the chairperson of the School of Psychiatry there, and it's good to have her on. Wanted to ask you this. I have a Facebook page, and a lot of people follow me on that page. I'll post things on there. And I wonder, I've heard from some friends of mine in law enforcement when I asked it about it. I'll post things on there, and I will notice that there are individuals out there that start it's almost like they're trolling, but they're sending individual invitation messages and commenting on comments that primarily women make. A woman may be commenting on my page about something in the news that I posted, and then the comment will show up there, something along the lines of, "I think you're very pretty. I appreciate your comment here. I'd like to get more to know you. Can we message each other?" Now, the first time I saw one of those, I thought, okay, well, maybe this is just a nice guy trying to reach out to this one. And then I noticed they show up and they start reaching out under a bunch of different names to many, many women. And I've talked to some of my friends in cybersecurity who say, yeah, these are folks trying to set up a scam. And they know during the holidays, people could be more susceptible to a friendly reach out, especially if someone's lonely. I wonder if you've heard of things like this and what advice you would have for someone when they see something like this, and maybe they're tempted to respond because these guys are trying to be flattering, say nice things, but the bottom line is almost everyone I talk to say this is some type of scam. They're trying to get personal information. What would you say about that?
Yes, I would agree with you. That's a very concerning pattern. Individuals, particularly at this time, may be feeling isolated, and during this pandemic may be less connected with other individuals. So these men who are reaching out to these women and other individuals may be trying to get personal information, maybe trying to take advantage of them financially or sexually. So these are predators, and I would encourage these women to stay disconnected or not engage with them at all, because they can be very flattering and subtly suck them into a relationship or just a place where they could be taken advantage. So my advice is stay away.
And that's the same advice I do. And when I see those, I immediately block them from my page. My one question to you is, I imagine the vast majority of these women, if not all of them, are intelligent people, and they should know better. And it's oftentimes in scams like this, or when it deals with money, but especially if you're feeling mentally down, it's interesting that they may fall for it. Explain the concept why, when you're depressed or feeling lonely, maybe all of them, if you ask them point blank, they would say, well, yeah, this is probably a scam, but for some reason their guard is down and they're more likely to be susceptible in that moment because of the way they're feeling now during the holiday season. It's kind of like common sense goes out the window, you know what I mean? They want so badly to believe this might be someone who really wants to get to know them, and so they throw out what they should know better because of the hope they're feeling for.
Right. So you mentioned a good point. So maybe it's a combination of factors, I think. Common sense goes out the window, or some things that they would normally say or acknowledge as a red flag, things that the person says they ignore because they want to be connected with somebody. At the same time, these individuals are usually very manipulative, very charming, and probably have antisocial, not just being socially distant, but having some negative, they're only looking out for themselves. So they're not looking out for the best interest of anyone else and looking to take advantage, what we would call sociopaths. And so they can be very charming, and many times those red flags are ignored. So there's a combination of factors that I think are in these situations.
I appreciate that. I just wanted to get that out there because I've seen it a lot. It usually happens year-round on a lot of pages, but it seems to happen more around the holidays. So I'm just curious, too. I want to remind folks, and maybe you can offer some insight. We all know there are helplines and the like out there. If someone is alone, and I always want to hit on this during the holidays, hey, message me, call into this show, but there is always help out there if people need it, correct? And is that as simple as a helpline that you call? We know there's suicide prevention and the like, but where can you turn during the holidays if you are alone?
Sure, that's an excellent question. And it really depends, unfortunately, on what resources are available to people. So if people are working and they have insurance, they may be able to contact their insurance provider to be able to meet with a counselor, a therapist, a psychiatrist, a psychologist, or even with their employer, they may have an employee assistance program. So being able to talk with somebody for some brief counseling. You can also talk with your primary care provider. So your family medicine physician, your internal medicine physician, because they can connect you or be able to give you some leads into how you can connect with someone. If you don't have those resources, there are community mental health centers according to where you live. But again, those are for sort of minor or less urgent problems. If there is an urgent problem, there are various hotlines, and I can tell you and perhaps send that information to you in the chat, but there's a national suicide prevention line, there's a disaster distress helpline, there's a crisis text line. So if you're in a position where you may be experiencing more physical abuse or sexual abuse as people are isolated more, we're also concerned about the numbers of those people experiencing those situations, those numbers going up. You can text if it's not a situation where you're able to call. And then if you're a veteran, there are also veteran crisis lines. So there is always help and people who can help you more urgently. And if it's a less urgent problem, there's a way to reach out for help in a more extended way.
You are a doctor, correct?
Yes,
okay.
I'm an
and
MD.
You are a psychiatrist.
I am a psychiatrist.
And I know that. The reason I bring that up is if you would, just for some of our viewers, to give an explanation and how you view the difference between a psychiatrist and a psychologist in terms of what someone should seek out and what the differences primarily are.
Sure, that's an excellent question. So as a psychiatrist, after college, I went to medical school. And I spent 4 years in medical school training to be a physician and learned about children and delivering babies and participated in surgeries and psychiatry and understanding internal medicine, whether or not somebody has gout or hypertension, diabetes. And then after those 4 years of medical school, I spent an additional years in training in terms of psychiatry specialty. And my subspecialty is child and adolescent psychiatry. Hang on just a minute.
That's all right.
And hold on. I was getting a call.
Oh, that's all right. If you got to take an emergency call,
okay.
I understand. But as a doctor, as a psychiatrist, you are able to prescribe medicines, are you not?
As a psychiatrist, it's not just that I'm able to prescribe medications, but people can present with emotional problems that actually present with physical problems.
Okay.
So, for example, if somebody has problems with their thyroid, either being their thyroid hormone being too high or too low, they may present with anxiety symptoms or depressive symptoms. Or somebody who just had a heart attack may have some depressive symptoms. So we're also, as we interview and talk with patients, we are able to sort through, are there medical problems? Are these emotions a complication of a medical problem? Or is there really a problem just focused with the brain and the way people are experiencing their thoughts and their mood? So that's different from a psychologist or a therapist who also goes through training in terms of undergraduate with college and then may get a master's or a doctorate level in terms of social work or psychology or counseling or marriage and family therapy. And there are different types of therapy to address different types of issues. So those individuals have specialized training to talk about whether it's grief or interrelationship problems with a marriage or dealing with anger or conflict, dealing with low self-esteem, but they're not trained on the medical aspect to sort through, if there's a medical problem going on. And in most states, they're also not licensed to be able to prescribe medications for the emotional problems that are medical problems. Depression is a medical problem.
Sure.
Post-traumatic stress disorder is a medical problem. Panic disorder is a medical problem. So we're approaching it not just from understanding the physiology of what's going on, but the social aspect of what's going on, the psychological aspect of what's going on, because there are social factors with depression. Your approach in terms of how you view the world and how you view yourself can have an impact in terms of how your depression is treated.
Let me ask you a question, since you've said your specialty is dealing to some degree with children, and this comes from Candace on Facebook. What type of therapy would be recommended for an autistic, aggressive 10-year-old? And I know that's all I can tell you. I don't have more details beyond that, but what would you suggest? It sounds like the issue here is the aggressiveness.
Yeah, so that's a great question. Really, what I would recommend is that person have a complete evaluation, either a psychiatric evaluation or a psychological evaluation in terms of testing, because there could be many reasons for the aggression. It is common for individuals with autism spectrum disorder to have another psychiatric disorder or perhaps medical problem. So what you want to make sure is that you get a thorough evaluation to see, is the aggression untreated depression? Is it really just a core part of the autism spectrum disorder that is occurring? Are there adequate services for that 10-year-old child in the school system that are being addressed? And is there a comprehensive plan for the teachers, for the parents, setting limits, having a regular bedtime, appropriate food, appropriate, safety precautions? So it's hard for me to recommend what type of therapy without knowing the specifics of what's going on in that case.
All right, let's go to the phones again, and we'll go to Betty. Betty, good morning. Hi, Betty.
Hello, Nick.
Good morning.
Good morning to you. Thank you for having the doctor on this morning. I don't have any questions for her, but I do have a question for you.
Sure.
I tried to get you on Facebook this morning. I can't seem to get you.
Okay, now the show right now is on newschannel5.com on Facebook. So go to News Channel 5's website, or rather Facebook page. Instead of Nick Barris NC5, go to News Channel 5's Facebook page, and you should be able to find us there where we're streaming. I see an awful lot of people on there right now and sending questions. I apologize for that. I should have been more clear. But yeah, it's the News Channel 5 one, not my personal one. Doctor, with regard to the fact that you are medically trained, and you did a great job explaining the difference between psychiatrists and psychologists, is there an instance perhaps where an individual is really dealing, whether it's panic disorder because of the pandemic that's escalating during the holidays or whatever else, where you would look at maybe prescribing some type of short-term medication to try to help them better deal with their anxiety? Is it medication, or is it everything else? And I'm not saying a pill to cure all. I know there's other ways that you've suggested to do that. But let's say in extreme cases that maybe someone, and maybe it's all they need is to take it through the holidays. But what would you do to consider that?
Yes, that's an excellent question. So when do we consider medication? Certainly, as I mentioned, depression, anxiety, post-traumatic stress disorder, these are all medical problems. So this is not just a character flaw or personal weakness. We actually know that there are neurochemicals or hormones, neurotransmitters, that, let's say, for example, dopamine, serotonin, norepinephrine, that are affected in our brain when we're depressed or anxious. And so, for example, we don't have the science to the point that we're able to measure those on a regular basis and say your level is low, and so let's do this. But what we do have are standard guidelines in terms of the diagnosis of panic disorder or generalized anxiety disorder or depression. And so when people have mild depression or anxiety, we may use just therapeutic modalities, different types of therapy, and modifying their environment and their living situation and their approach to their problem. If it gets to the point that it's moderate or severe, meaning that the symptoms have been going long enough, they're intense enough to cause disruption in their relationships, in their work situation, in their home life, or to the point that it's causing problems with them being safe, then we recommend different types of medications. And according to the specific type of anxiety disorder that they have, there are a variety of medications. And we look at factors such as what other medical problems do they have, what insurance do they have that might pay for the medication, what are potential side effects that could help the situation. So, for example, if somebody is depressed and they're having a harder time sleeping, we may choose an antidepressant that has a little bit of a sedative effect to help them sleep. And different types of medications have different long-term effects and consequences. So we're really individually tailoring the treatment to meet the needs of that person.
That's a great answer, and I think that's the way you go. Unfortunately, we do know sometimes during the holidays or whenever someone's feeling this way, they may try to self-medicate, and we can discuss that perhaps when we come back and why that's not a good idea. When I say self-medicate, maybe turning to liquor or whatever else. We'll take a break. Be back with our final segment with our guest. If you have a question, a comment, you're welcome to call us at the number here, and also I'll be checking for any comments on Facebook as well. We're streaming live right now at newschannel5.com. We'll be back with more in The Good Doctor right after this.